Doctor, I mean, just break this down. How does this work?
Well, this is a medical grade wearable that we developed actually before COVID to be able to monitor patients after they leave the hospital. And one of the most important things you're concerned about after someone leaves the hospital is developing an infection. So, whether it's a cancer patient or someone that's had surgery, we developed this technology for what's called remote patient monitoring. And, it was cleared by the FDA just at the end of last year. We were launching it into large hospital programs, and then along came COVID. And this is a device that was built to monitor continuously your body temperature, your respiratory rate, your heart rate. All of those things are changed during an infection. And so with that, hospitals started using this to monitor COVID patients very broadly.
I think one of the things that stood out to me is it says it's scalable and cost effective. How scalable and how cost effective?
Well, when you look at the cost of keeping somebody in the hospital to monitor
Mm-hmm.
them, you're talking about $2,000 a night, and now you can send somebody home with a sticker a day or two earlier and just keep monitoring. And what we've seen is obviously we're doing this via a virtual interview. Virtual care for taking care of patients has also exploded over the past 8 months. And so being able to monitor somebody without having to have them hospitalized has changed everything. But you need to be able to have some kind of technology. And we're used to wearables in our daily lives for the past decade with Fitbits and Apple Watches. But those aren't medical grade devices. And so doctors and hospitals need something that's going to measure those vital signs as accurately as what we have in the hospital.
But does it track you where you go? And has anyone expressed concern about that?
So these devices do not do what we call location tracking, and we understand and appreciate those concerns. For that very reason, this is monitoring your vital signs. It's transmitting that data via Bluetooth, just like we're used to again with our consumer wearables. But in this case, it's a little sticker that's on your chest where it's more reliable to measure your body temperature and your respiratory rate and your heart rate. And when we go to a restaurant, they're doing their best to try to assess whether or not you might be sick. But the problem is that's a single snapshot of your temperature. And what this is actually doing is it's quietly monitoring your temperature 1,440 times per day. In other words, every minute. And then also your heart rate and your respiratory rate and other things that actually make it quite reliable to identify if someone is starting to develop an infection. And as you can imagine, we have a lot of people getting COVID tests just to be able to go to work, or the Screen Actors Guild every other day, football players and so forth. And unfortunately, and you've done this well in the lay press, explain the fact that a negative COVID test yesterday doesn't tell you whether or not this person might have COVID today.
Right. That is a very good point, and one that I face is we take weekly tests to come into the office, but it's just a snapshot, right, of that one moment. I
So
am
now we
curious.
have a 4K movie of someone every day. So our technology actually does a look back over the last 24 hours and says, is there anything about their vital signs that might be a concern for a new infection? So it's almost like a daily COVID test.
What if I'm asymptomatic?
Well, isn't that interesting? It turns out that asymptomatic is a bit of a unicorn. What you're finding is that asymptomatic is being reported as high as 80% of COVID patients are asymptomatic, all the way down to less than 10%. And what that tells you is two things. One is the definition of asymptomatic is all over the map. Asymptomatic could mean that this person just never had a fever greater than 38 centigrade or 100 degrees Fahrenheit. Or it could mean I don't think I had any symptoms, so it's kind of subjective. The reality is it is very difficult to have an infectious process without your body responding to it in some fashion. So this comes down to what is the resolution of your instrument for measuring symptomatology? In other words, if you're just taking one temperature per day, you're probably not going to see it. But if you're taking 1,440 temperatures per day, you're actually having what are called microfevers, and you're just not aware of it. So it really is, we've got kind of the Hubble telescope to be able to see things that you just wouldn't see in somebody that's not wearing one of our bio buttons.